Hey, Dr. Lindsey here. Hey, this is another one of these repair of an FUE videos that we have done. And there's a bunch of things that I need to tell you about this. If you're interested, there's two more of these that I've recently put up. One we repaired with modified FUE. This is kind of the same theme. But in particular, let's go through the list. First is, as I've talked many times before, FUE just never works as well as strip. Now, it's mainly because when we make a circular cut around each individual group of hairs and then lift the hair out, it avulses the bottom part of the root off. And some hairs react well to that and some don't. But in particular, skinny hairs don't. Well, this guy's got pretty good hair. The case I put up a couple days ago has very fine hair, and I'm pretty sure that's why I didn't work on him. I suspect this guy's had reasonable growth, pretty typical for FUE, but it's just not enough because he's got such a big color contrast. He's got really white skin and pretty dark, wiry hair. And so that color contrast, no matter how dense you get it, is oftentimes not as much as the consumer wants. But he probably had half of those FUEs he got put in by a perfectly competent FUE doctor work. It's just not all of them worked, or they weren't put tightly enough together. Next is, how do we do these repairs? We do them just like plug repairs. We trim the hairs that you've already paid for down, and then we make holes as close as I can to the existing hairs, trying not to hit any roots that have already been paid for. And that lets us get them in there real tight. Either way, at about a month, all the hairs we put on are going to fall out, and most of the hairs that are in that recipient area are going to go into shock loss. And I'll show that in his 2-month pictures. But we can at least get it really tight, and then we shave off those remaining hairs so that the girls can find the holes and really not miss any areas. The downside of that, though, is in this post-op pictures, is immediate post-op pictures. It looks like you got a lot of hair, and then there's spots where there aren't any hairs, and that's because there's already hairs there that he's paid for. Next, cleaning and smoking. This fellow promised me he didn't smoke, and he admitted yesterday when he came in for his 11.5-month check that he smoked all the way through and used nicotine patches. I can't prove that that does anything yet, but it certainly affects skin grafts, and I'm trying to do a study where we show that the way hair gets revascularized is just like a skin graft. So if we're lucky enough that we can get this animal model going, maybe I can show that. But I think that cleaning's a bigger issue. He really did quite poor cleaning, and he admitted yesterday that after I gave him a hard time about not cleaning, he went home and pulled a bunch of hair out and didn't tell me in a month. You know, at least he's honest enough today, but he still turned out good. But you know, you got to follow my cleaning instructions if you get done here. His pictures of a month is completely normal appearance. I show you scar. Scar looks great. His recipient area has some shock loss, as you'd expect, but he can just camouflage it by styling his hair. And then yesterday when he came in for his 11.5-month check, you know, on any redo case, because of their scar tissue underneath the skin, it typically takes 15 to 18 months. So he's probably a little bit early. That's issue 1. 2 is he'd forgotten about the color contrast. I pointed that out to him. And so no matter how thick it is, how dense it is, and turns out when you have really white skin and really dark hair, it looks like you need more. And I completely have that. It'll look good when he's got gray hair like I've got, and it matches better. And then lastly, like a lot of these guys who are repair cases, he comes in and says, did we really accomplish anything? Well, I don't know. First thing, if you've been to my office, we walk over to the blue wall and we take a picture. And then we go to my computer and look at the befores and afters. And it's just like when I've done facelifts. People forget what they look like. So immediately I put up his before picture, and then his picture at 11.6 months. And he was like, oh my gosh, I forgot how little hair I had. So it's not a perfect result, and I think it'll get a little bit better over the next couple of months. And he certainly looks unremarkable, which is always my goal. You see this guy at Safeway or at the mall, and he does not look like he had a hair transplant or a 4 hair transplant, nor does he look like he's losing his hair. So my advice to him is, you know, come back in a couple of months and we'll take a look. I don't think he needs to do anything else. But like many hair patients, he's a little compulsive about it, and if he wants to put a few more grafts in there, we can probably find room for him. I've posted many a video going through this with people that are compulsive about things. And I'm compulsive about things too, just not my hair. So I can completely get it if he wants to do it. So take a look at this video and it goes through all these topics. Thanks.
How you're not?
Yeah, no. So this is a year out, right? I just want to show your scar. It's pretty good. I'd give it a A in the middle and a B on the corner. I don't see much in the way of donor depletion or even FUE spots before. I think when I trimmed you down, I could see a bunch of little white marks, but I don't see those today. Chin down just a smidgen, if you would. This fellow was just saying to me that the place he went before, they put some hair in here. And while I didn't tape this whole conversation, we spent a lot of time talking about he's got a Brillo pad hair like I got, and it's difficult to manage. I generally don't put any hair there, simply because you can't get it to lay right. And you said that you have to comb it forward and kind of cover that area.
Yeah.
Again, you're your own worst critic. I can tell you, if you ask anybody that would see this video, they're not going to know that. But you know it.
Mm-hmm.
You know. So again, this goes along with the video I did on a lady's sideburn the other day.